Hi, I'm Dr. Todd Shatkin. The Aesthetic Associates Center offers complete cosmetic, implant, and restorative dental care. For nearly 20 years, we've been providing Western New York patients with beautiful smiles, and I'd be delighted to see you for a complimentary consultation. Please call us today at 716-839-1700 or find us online at www.gr8look.com. That's greatlook.com.
As we're getting ready for our spring holidays and your family get-togethers, is it time you showed off your new smile? It can happen through the good work of the Aesthetic Associates. Dr. Todd Shatkin joins us with more information about what they can do for you, so you can call us now with your questions at 644-9840. And it's pretty remarkable because we're going to be talking about, as you were telling me, single tooth replacements in one visit.
Right. Well, that's a procedure that I developed, and it's a patented procedure, and we've talked about it before, but I wanted to talk a little bit more about it because there's a lot of people out there who are missing one tooth, maybe two teeth, and they don't need a whole full mouth of dentistry, but they just maybe are missing one molar or a front tooth or whatever that they have a removable partial for. And those partials can become kind of uncomfortable and kind of a pain in the butt really to deal with, because you have to take them out and you have to clean them. And for one tooth, it's really not, one or two teeth, it's not worth dealing with this big apparatus that they have to put in their mouth.
So I bet most people just go without after a while.
A lot of times they leave them out. And so the great thing about the first procedure, which is my procedure, fabricated implant replacement and surgical technique, it's a great procedure because in one visit we can put the implant and the crown in.
All right, well, can we see some pictures?
Yeah.
Okay, let's go. Take a look. All right, here's one.
Yeah, this is a gentleman, I think it's a gentleman, it's missing a lateral incisor, which is a very common tooth to be missing. In this case, it was knocked out in a injury, but many times people are congenitally missing lateral incisors, and they have to wear removable, like retainers type of thing. And here we replaced it with an implant. You can take a look at the next picture. And here's the space where the tooth was, the implant, the little mini implant in place in the gum. And then there's the tooth replaced right at the same time as the placement of the implant.
Wow. I have a question. If teeth need to be moved over, you can do that too, to get it ready, to get that space ready, or else you can just make the tooth the size of the hole?
Yeah, if you have a narrowing of the space, which can happen, and it's good that you brought that up, because a lot of times when you lose a tooth, the teeth shift and they move into the space.
It's like getting more room in bed. They move out, move over.
So the thing is, you might have to do Invisalign or orthodontics to move the teeth apart, but that brings up an important point. If you do lose a tooth, it's important to replace it soon, because if you replace it within the first few months, those teeth don't have a chance to move. But if you wait a year, 2 years, 3 years, the teeth can change, shift, and your bite can change.
Okay. All right. So that's good to know. Good to know. All right. I think we have another before and after, so you can see the difference. We'll take a look. There we go.
Well, that's the after of that same case with the smile of the tooth replaced. Here's another one of a single front tooth being replaced, and I don't believe I have the picture of the actual implant in the bone, but there it is immediately after. And so again, about 30 minutes you can have this done, the implant and the tooth. And here's a molar. In the molar area we put 2 mini implants in. So the next picture will show the 2 mini implants in place, and there's the tooth replaced.
And again, nothing in the roof of your mouth, no other appliances. It stays in there. You brush it.
You can floss in between the teeth. You don't have to grind down the natural teeth on either side as you normally do for a bridge, a fixed bridge or crowns. We don't grind the teeth down. So we're preserving the healthy enamel of the other teeth, and we're just simply replacing the tooth that's missing.
How young can you do this on a patient?
Well, if you recall, a month or so ago we had the pictures of a 14-year-old boy who had a similar thing, congenitally missing laterals, and we did it on him. So I think probably 14, 15 is the earliest, and then up to 95. We do them on
That's amazing.
Very elderly.
If you were to do it on someone young and their mouth shifts a little bit, is it easier to take the teeth out and leave the implant in and then just change the tooth?
Yeah, you can change the tooth if of course they're going to grow.
Yeah.
And things change. And you can just cut the crown off and then take a new impression 3, 4 years, 5 years, 10 years, whatever down the road, and replace the crown.
That's amazing. When you think of years and years ago, how things had to be what you did to make it look more natural. I mean, to where we are today, it's amazing where modern dentistry is becoming.
Even now, typically it takes 6 months to a year to replace a tooth with conventional implants.
Wow.
And with these mini implants, with this procedure, you can do it in less than an hour.
That's amazing. I was watching the Discovery Channel, and they were showing that they were getting to the point where they're growing teeth. Isn't that amazing?
They are. They're talking about transplanting them.
Yeah, so you could literally have your own tooth someday.
Right. They've been working on that for a number of years, and I think some of the universities have tried in animals to do that.
But we have really good components now. We have really good products to mimic your natural.
Yeah, and, I think you're almost
enamel.
now with these procedures, you're almost better off with this than trying to reimplant a tooth that may or may not come in properly or look right anyway, because you have to put it in as a tooth bud, and then it's got to grow like a normal tooth, and it could come in crooked again, just like your own tooth. So then you may be at the dentist having it fixed anyway.
Amazing. So. We've got a phone call for you, Dr. Shatkin, someone with a question or comment. Hello, welcome to the show.
Hello.
Hi, go ahead, please.
Hiya. My question is that I have more than 2 that need to be done, probably 2 on each side in the back, and my teeth has shifted. And my question is, first of all, how many procedures does that take, and how painful is it? One more question, I'm sorry. What does this cost in range?
Okay.
Well, you ask all the right questions.
Yes.
Those are the most common questions. How long does it take? How painful? And how much does it cost? It doesn't matter whether you're missing 1 tooth, 6 teeth, or 10 teeth. We can still do it all in one treatment visit. So what it entails is you coming into the office for a consultation. If we look at the x-rays in your mouth and determine that you're a good candidate for this, we would take impressions on that appointment and then have the laboratory, which is in our facility, and we do the lab work for dentists all over the country, because we've done this for over 1,200 dentists who've sent work to Buffalo to have the work done. So then about 2 weeks later, you'll come in and have the procedure done, and that will just take between an hour and 2 hours if you have multiple teeth. And there's really very little, if any, discomfort because we're not cutting the gum. There's no surgery involved. It's a small little pinhole we make through the gum. We thread the implant in, and then we cement the crowns on. Now, as far as cost goes, that varies, of course, depending on which teeth and how many teeth. But on average, it's about $1,800 per tooth.
But you can help with that as well, because you have a lot of different payment plans.
Absolutely. We have financing. We accept most of the insurance companies, and a lot of insurance companies are starting to pay for these implant procedures. So if you have decent insurance, we may be able to get part of the insurance coverage.
Right.
And then the rest of it, we take all the major credit cards, and we also have financing through a couple of finance companies.
But it sounds like such a worthwhile thing to do when it's your mouth.
And we have 0% financing, so that helps too.
That's incredible. So the most important thing is to go in and get that consultation.
Right.
Go in and see what can be done.
And there's no charge for the consultation. If you want to come in for a complimentary consultation, see if you're a candidate, we'll give you an estimate of the cost, and then you can decide what you want to do.
Doesn't get better than that. Dr. Todd Shatkin with the Associates, the Aesthetic Associates. I'm sorry, I got my AESs mixed up. Let's give you the phone number. Let's give you their address, because it's really such a worthwhile visit to learn that information and to make your smile its very best. Give them a call at 839-1700. They're very easily located at 2500 Kensington Avenue in Amherst, 839-1700.